So let's get started. What is HIV? So this particular virus can only infect humans. HIV attacks what's called your T cells, or CD4 cells. And it uses them to make copies of itself. And then from there, when HIV destroys so many of your cells, it ends up to be AIDS. And a little bit more detail there. So understanding how HIV works. So an HIV positive's immune system is measured by counting the CD4 or T cell count. Both those terms are interchangeable. A normal CD4 count is between 600 and 1500. An AIDS diagnosis is when a client's CD4 or T cells is below 200. And as the CD4 count drops, the weaker immune system then results in opportunistic infections such as getting pneumonia, Kaposi's sarcoma, and many other ones. So what's a viral load? A viral load tells us how much HIV virus is in the blood. A viral load increases more and more as the virus is produced. So the goal is to get that viral load undetectable with treatment, and that's primarily with antiretrovirals. And also the goal is to have it be undetectable, and that's usually defined as 50 copies per milliliter in someone's blood, per blood cell. So it's complicated science, but that's a simple way to put it. So how exactly does HIV work? Okay, first, HIV attaches to the host CD4 cell, or T cell. So this whole thing is a T cell, or CD4 cell. Then it reverses the transcriptase and makes DNA from the virus's RNA. So basically, it's kind of taking over. It's like hijacking the cell, in other words. And then it integrates into the host cell's nucleus. So the HIV basically becomes one with the healthy cell's nucleus. And then the reproduction of the viral component. So then it keeps reproducing and building on itself. And then it assembles new HIV viruses, so then HIV expands, the cell expands. And then it releases into the bloodstream, affects other blood cells, and becomes AIDS. The disease progression. So this slide didn't come out totally clear, but over time, so the viral load in a client that has HIV will increase. The CD4 or T cells decreases. And then because it decreases, the client's immune system is so weakened. This is when opportunistic infections and the signs and associate symptoms with HIV infections, such as pneumonia, such as Kaposi's sarcoma. So acquired, or A, is when an individual immune system is damaged to the point that these individuals are said to have AIDS. So antiretrovirals, so after we'll go into the history of AIDS shortly, but antiretrovirals are the main treatment for treating clients that are HIV positive. And the goal is viral suppression and reduction in the transmission risk. So it's to suppress HIV to below the limits of detection for as long as possible, hopefully permanently, to prolong life and improve the quality of life. People now are living with HIV and AIDS 20, 30, 40 years, whereas when AIDS first came out or first was diagnosed and came on the scene in the early 80s, it was basically thought of as a death sentence. And it was, unfortunately, for most people at that time because there wasn't this treatment. Also, another goal is to preserve or restore immune function, because remember, when the client's immune function is lower, that's mainly when all these other opportunistic, the tongue twister word, infections have a chance to invade one's immune system, and that's more what usually ends up killing a person, not so much, quote, the AIDS itself. Also, to reduce the risk of transmission from other sex partners or to sex and drug partners and from women to a baby, and also to reduce HIV opportunistic infections.